vitamin D. So vitamin D is essential for so many reasons. And again, as Alex mentioned, it is something that creates so much health. It strengthens the immune system, prevents diabetes. Diabetes, I'm not sure if you're aware, is one of the most prevalent diseases now. It's actually probably going to be taking over as the most common disease process, I would say, within the next decade or so, because of the food quality, because of the amount of stress, because of the poor nerve supply to the pancreas, etc. And we have this terrible thing going on now, which is insulin resistance. So you want your vitamin D because it stimulates your pancreas to make insulin. Vitamin D also lowers blood pressure, prevents heart attacks. Heart attacks are the second leading cause of death in the United States right now. And again, this might be new news to you, but the number one leading cause of death in the United States, and to me this is old news, but to some of you this might be new news, the number one cause of death in the United States, and it has been since I can remember, is drugs and surgery. So allopathic medicine. And when I'm not saying that the MDs are bad or wrong or anything, but they're just in a model that doesn't work. They've been educated in a model that doesn't work. And so, and we have all gone down that road as well, due to and I'm just going to be very honest because I always tell the truth, being the huge amount of money that gets made by pharmaceutical companies. So nobody's doing anything on purpose apart from the people that are. So we've got to really work hard with educating ourselves. So heart attacks, number 2, number 1, now you know. And then vitamin D prevents cancers, many of the cancers, and cancer is the number 3. It's the third leading cause of death in the United States. Vitamin D supports the absorption of calcium, good for bone density. I mean, if you're looking to have this radical longevity, you need a skeleton that's going to support you. You need a body that's going to support you. So you better get those vitamin D levels checked. And I'm a big believer in metrics, measuring. Whatever you measure grows. So get that vitamin D measured, keep monitoring it, and watch it go up, and watch your health rise, watch your energy levels go up, watch all of that get better. Now let's talk about sunshine and supplementation. You make vitamin D, the vitamin D that you're able to manufacture, you do that through your skin. Your skin needs to have that sun exposure. But what was the temperature today? Let's talk about the weather. I'm from England. I always talk about the weather. It was 21 degrees when we woke up this morning. What is it now? 28 degrees. I don't know if many of us are going out and, in a tank top and exposing as much skin to the sun. I have colleagues, actually, I mean, this will make you laugh. I have colleagues, and of course there are other doctors like me who are just complete health fanatics. They buy houses that have a lot of closure where they can just be naked in the sun. That's the best thing to do. But I don't think any of us are really doing that. So you're going to just need to supplement anyway. Darker versus lighter skin. When we have dark skin, we have a pigment in our skin that actually creates the brown, and that is melanin. Melanin is there to protect us from the sun, where we're genetically set up for more tropical climates. We don't make the vitamin D as readily as people with lighter skin. We have to be in the sun for a lot longer. So people with darker skin, where we have our brown skin, we need to be in the sun for at least half an hour before anything even happens with vitamin D. And then people with lighter skin, 15 minutes, but that's a long time when it's 21 degrees. I mean, I don't want to go out there sometimes. So most people need more than 5,000 IUs per day. In fact, if you really look at the numbers, and I don't want you to guess, remember I said everything needs to be measured, most people need about 20,000 IUs per day, and that's something that is extremely important for you to stay on top of. So really, you know, go deep with that. That's something to focus on.